Greetings. This is Justin Allen with the Elite Nurse Practitioner. This is the Fertility Clinic Course. This is the Elite Nurse Practitioner guide on how to start an infertility clinic and or integrate fertility management into your practice. This course will walk you through the clinical aspects of fertility optimization and infertility treatment. We will cover the clinical aspects of it as well as go over the business aspects of it. This is going to be considered one of our practice startup courses as well. So we will walk you through step by step on how to start a fertility clinic from scratch. So for those who already are operating a practice, doing HRT, men's health, women's health, whatever it may be, and you want to integrate infertility services, fertility optimization services into your practice, this will be an excellent addition to your practice. And then for those who are interested in starting a standalone practice, this course will cover the aspects of doing that. Fertility care can actually surprisingly be done via telemedicine. Most of this is laboratory-based medicine, okay? So we will cover all the aspects of it. So after you take this course, you should have a firm understanding and a solid foundation of fertility optimization and infertility management. Now, authors, I am Justin Allen, family nurse practitioner, owner, operator of the Elite Nurse Practitioner. I own 2 men's health practices and also a medical cannabis clinic. We do a lot of fertility management in my men's health clinic. We treat male infertility. We also help preserve fertility while men are on testosterone replacement therapy. So I will cover the male portion of this course. My clinic went from $0 to $100,000 a month in just 4 years, okay? So you can build a very successful practice that generates a significant amount of income, right? And then there's Tara Bradner. She is a DNP and she is also ASRM certified, which is the American Society of Reproductive Medicine. So she is the expert of infertility treatment and care. Okay, so she is going to cover the majority of the content in this course. Okay, she is an expert at it, and I think you guys will really enjoy her contributions. Now, what does this course provide? Our goal is to teach the nurse practitioner the foundations of infertility evaluation, treatment, fertility optimization, and how to integrate these services into your practice or start your own infertility clinic. So fertility optimization and fertility treatment is in demand and ever increasing in need. As older patients are trying to conceive, okay, it becomes problematic. They need fertility optimization. They need to increase their fertility. And infertility is on the rise. So lots of patients are seeking treatment for their fertility issues. So it is very, very in demand. And there is really not a lot of competition out there. So this is one of those services that is very niched and very in demand, okay? So what we will cover the foundational knowledge of male and female fertility. We will talk about the assessment of the infertile individual, okay? How to test them, right? How to evaluate. We're going to cover the lab testing, okay? This is predominantly lab-based medicine, all right? We will cover all that. We are going to cover a plethora of various treatment options that nurse practitioner can implement into their practice. We are going to cover lots of medication management that enhances and treats infertility in people and optimizes their fertility. Okay, so we're gonna cover a lot of the medication management components of it. And we'll also talk about when to refer to a higher level of care, in vitro fertilization, things like that. That is beyond your scope in most cases. Okay, so you will have to know when to refer, but you are going to be the baseline for fertility treatment. Okay, luckily, a lot of this is going to be based around medication management and lab testing. Okay, most patients can get away with medication management in the initial stages. Okay. So that's what we're going to teach you. That is within your scope as a nurse practitioner. We're going to talk to you about how to integrate and implement infertility care into the practice or start a standalone infertility clinic, which can be done via telemedicine, like I mentioned earlier. Okay, you can do this via telemedicine, and there is not a lot of competition out there. This can add another powerful revenue source to your practice as well. If you already have an established practice, this can be another great service to add and complements HRT practices and wellness clinics. Okay. Plus, you are helping people obtain the most precious gift of all, which is a child. So this is very, very rewarding to do. So why open a fertility treatment clinic or integrate this service into your practice to begin with? I've already touched on a lot of this, but approximately 10 to 20% of individuals trying to conceive will run into infertility problems. So 1 out of 5 people will run into infertility problems at some point, all right? So therefore, it is in demand. It will continue to grow as our population grows and ages. Infertility care and fertility optimization is estimated to be an $8 billion market, and it's predicted to grow, okay? So it's big money. There's lots of money in this. There is a lot of demand, okay? So it's becoming more and more mainstream, and a problem is people are waiting longer and longer to have children. So for the astute nurse practitioner entrepreneur, it could prove to be a very, very lucrative service to implement into your practice or start as a standalone clinic, all right? Now, it's fairly easy to learn the foundations of infertility care and implement into your practice, okay? It's not rocket science. We are going to cover what it is that you need to know. Very little equipment or supplies are needed here, all right? This isn't Botox. This is an IV infusion, okay? You really don't need that much to get started. There's very little overhead, similar overhead to what you would see with an HRT practice or weight loss clinic, right? It's practically laboratory-based medicine, like I mentioned earlier. A multitude of first-line treatments are a prescription that a nurse practitioner can prescribe. So it is within your scope to do a lot of this. So basically, guys, it is a low barrier to entry service line, right? It's not terribly difficult to get started. So it can make for a great cash-based practice, but insurance can cover this. So if you are operating a primary care clinic, for example, and you are insurance-based, this is a great service to have because you can bill the insurance companies for the visits and stuff like that, right? But they might not cover the medication. So just as an example. So who can implement infertility management and treatment into their practice? So most nurse practitioners have it within their scope to provide infertility assessment, evaluation, and treatment. Now, sorry about the acute care folks out there. A lot of acute care people are very, very stuck in what they can do, okay? So acute care could be questionable, but this knowledge is still critically important to understand across the board, right? Now, this makes for a great service line for established practice owners or as a standalone practice for those wanting to start their own practice, okay? It is fairly cheap to get started doing this. Like I mentioned before, there's very little equipment needed. You really just don't need much other than basic office and medical supplies. And if you do it via telemedicine, you really don't need much at all. You can send them a lab order, they get labs drawn, and you get results, and you can talk to these people via telemed. So it can be done. Like I mentioned, very low overhead, low expenses. If you're starting as a standalone practice, this can be done very cheaply in like a one-room office. It doesn't require a whole lot. Now, this also has solid margins. Profits are generated through the visits and medications, as many of these medications can be prescribed from compounding pharmacies. So similar to other service lines like hormone replacement therapy and weight loss, a lot of these meds are prescribed through a compounding pharmacy or a specialty pharmacy, which from a cash-based perspective allows you to mark it up and make a small profit, okay? If the insurance covers a med, great, you can send it to Walgreens or Walmart or whatever, right? So insurance can reimburse for a lot of infertility care in certain scenarios, but a lot of times those medications are not going to be covered, especially from a fertility optimization standpoint. So just keep that in mind. There are some solid margins there. It's similar to a weight loss clinic or an HRT practice. Now, what are we going to cover? So we're going to cover the foundational knowledge of infertility medicine. We're going to discuss myths surrounding fertility care, okay? There's a lot of misconceptions about fertility treatment. We're going to cover the initial evaluation, assessment, and the workup for both men and women, okay? This isn't for men, and this isn't just for women, okay? It's for both. We're going to cover the labs you need to know. We're going to cover the treatment options for both men and women. We're going to talk about when to refer to a higher level of care. So sometimes you have to refer people to, board certified fertility experts. You have to send people to urologists, GYN, those kinds of things. All right. So we're going to talk about that. We're going to talk about some of the secondary conditions that can cause infertility. So if you treat the secondary condition, oftentimes the fertility will improve. We're going to talk about how to look at the patient from a holistic standpoint. So for a lot of those people that are interested in functional medicine or have a functional medicine practice, this course would benefit you. We're going to talk about how to document. All right. We're going to talk about insurance billing. I'm going to talk about all the practice creation, integration aspects. We're going to talk about pricing, malpractice marketing, and much more. All right. So this is a pretty comprehensive course. I think everyone will enjoy it.